In Chapter 3, we're going to start assessing and exploring our own personal values and how that might affect and influence the therapeutic relationship. When counselors expose their values, it's important that they clearly label them as their own. Counselors may not agree with the values of their clients, but it is essential that they respect the rights of their clients to hold a different set of values. Counselors should not attempt to teach their clients specific moral rules and values because doing so violates clients' diversity and prevents them from growing by making their own choices based on their personal values. The core challenge is using values to enhance the therapeutic process without abusing the counselor's power and exploiting the client's vulnerability. Therapeutic environment imposes a strong value of avoiding a judgmental attitude. Remain objective. Inform clients of areas where your values will not allow you to be neutral. Your job isn't to approve or disapprove of your clients' values, but to let them explore and clarify their beliefs and apply their own personal values to solving their own problems. It's not the counselor's job to teach proper behavior. Do counselors really have a greater wisdom than their clients? Counseling is not preaching, persuasion, or instruction. However, keep in mind that you don't have to be so objective that you keep your personal reactions and values hidden from clients. Just let them know that they're your values. Clients want and need to know where their counselor stands, so honest involvement can be helpful. In addition, counselors shouldn't just sit by and watch their clients make bad decisions without interference. Introduce alternatives. The new edition of your book introduces the word bracketing. This is the ability of counselors to manage their personal values so they don't contaminate the counseling process. Brace in 1977 developed 10 ethical guidelines to follow when helping clients develop their treatment plan goals. Examine the goals before they're adopted to be sure that these goals are in the best interest of the clients. We know that sometimes the client's goals are so high that they can be really difficult to achieve, and you might have to help them to take baby steps and maybe start at a different goal that's easier to obtain. Ensure that goals are mutually consistent. Justify the pursuit or end goals and the means to attain them. Assess all causal and contributory factors that might pertain to the goals. Inform the client of values, especially if such values are likely to influence their choice of these goals. Avoid or correct errors in clinical judgment. Assess the risks that the client's goals might pose to them or others. Consider how the client's goals may affect others. Avoid deceiving clients and honor any promises made to your client. We have to be really careful about imposing our own personal values on our clients. If we have preconceived notions of what we think a client should have, that might affect the therapeutic relationship. A survey found that these values that a group of mental health professionals felt that clients should have include self-determination, developing effective strategies for coping with stress, developing the ability to give and receive affection, increasing one's ability to be sensitive to the feelings of others, becoming able to practice self-control, having a sense of purpose for living, being open, honest, and genuine, finding satisfaction in one's work, having a sense of identity and self-worth, being skilled in interpersonal relationships, having deepened self-awareness and motivation for growth, practicing good habits of physical health. These might be your values or your goals for your counselor. Your nonverbal behavior and body language gives your clients an indication of how you're being affected by their problems. Subtle messages you project can be powerful influence on your client's behavior. It's really not realistic to assume that there won't be some value conflicts between clients and their counselors. The challenge for the counselor is to recognize when their values clash with the client's values to the extent that they're not able to function effectively. Sometimes it is possible to work through such conflicts successfully. You may need to consult with your supervisor. But keep this in mind. Merely disagreeing with a client or not particularly liking what a client proposes to do is not ethical grounds for referral. If you decide a referral is necessary, how the referral is done is critical. Make sure that the client understands it's your problem, not theirs. They may interpret this as a personal rejection. New information presented in our book talks about discriminatory referrals. The author says that too little has been written about situations where referring a client is inappropriate, unethical, and may constitute an act of discrimination. Shiles in 2009 says many providers rationalize referrals as a way to avoid harming the client and practicing one's level of competence. In other words, they say, well, I have these conflicts with the client, and for their own good, I need to refer them to somebody else, or I think that the client's issues are too difficult or outside of my scope of practice, so I'm not competent in dealing with it. He says this situation, this issue has gone on unchallenged for way too long. When making a referral based on a value conflict, ask yourself these questions. What skills am I lacking in counseling a client struggling with a critical life decision? How can I determine what would ethically justify a referral? It is not ethical to refer clients based solely on a difference of values between the counselor and the client. Counselors do not have to renounce their own values. Avoid using your values to steer clients in a given direction or to make decisions for your clients. I want you honestly to review the questions in Chapter 1 on page 76 in the new edition. How do you feel about some of the questions that you answered? I really like the two examples that your text talks about when it's discussing discriminatory referrals. A couple of lawsuits they mentioned. The first one was Julia Ward. Julia Ward had a Christian faith, and she says this prevented her from affirming a client's same-sex relationship. She didn't want to affirm it. She said her values were opposed to it. She didn't believe in it. And so she was being a little judgmental. Ward was dismissed from the counseling program. She sued the university for doing this in the U.S. District Court based on violating her religious freedom and her civil rights. The district court ruled in favor of the university under prohibiting discrimination. I guess there were some lawsuits that went back and forth. She appealed. Eventually it was settled. In Jennifer Keaton's case, she declined to participate in a remedial program designed to assist her in managing to keep her personal values separate from those of her clients. So apparently it was an issue. She was using conversion therapy to gay clients and to inform them that they could choose to be straight. The Federal Appeals Court found in favor of the university. In your chapter, it defines the Freedom of Conscience Act, Arizona Senate Bill 1365. I think this is really important to know. It ensures that mental health professionals will not put their license status in jeopardy by denying services to clients on the basis of sincerely held religious beliefs. In different counseling fields, especially substance abuse counseling, there has been a precedent set that you need to have experienced addiction or walk through that situation in order to be an effective counselor. A lot of research has been done on this issue, And overwhelmingly, it is suggested that counselors don't have to have experienced the same struggles as their clients to be effective. So just taking substance abuse as an example, if you understand addiction, if you understand relapse, if you get recovery, if you're empathetic, you can be a good counselor. Your relationship and non-judgmentalism is what makes the therapeutic relationship most effective. That's where trust is built. When counselors and the clients connect at a certain level, cultural and age differences can be transcended. Establish what factors in your life would either help or hinder you in establishing a good working relationship with your client. All of us has been through pain, hopelessness, sometimes depression. We can all relate to our clients at some level.